All right, everybody. I think we are right at 12 o'clock, so we're going to go ahead and get started. Good afternoon. I'm really happy to join you guys today for our biannual meeting that we have, a webinar update that we try to do for everyone twice a year. My name is Helen Hockey. I am the Executive Director for the Pennsylvania Coalition for Oral Health. We're really glad that you guys have decided to join us today. And hopefully we can give you a brief update on some of the work that we've been doing. So whether this is, your 10th PCOH webinar update or your very first, we are really glad you're here, and we hope that we'll be able to share some information on our work that might be helpful to the oral health progress that you're trying to make, in your various roles. So just a little housekeeping as we get started. This is a webinar format presentation, which means that all of our attendees are off camera and muted. You will be able to type questions into the Q&A box, or if you have any technical concerns or issues, you can always dump those into the chat. So all lines are muted, and we will be able to address some questions either throughout the presentation or at the end, as well as after today's presentation. For anyone that was registered for this session, we will make sure that you get a copy of the slides and a copy of the presentation, so that if you do have to join by phone today, you'll still be able to see the resources that we're sharing. I also want to point out that, as always, because we're on limited time, we do put a lot of additional links and resources into our slides. So you'll see there are clickable links throughout. So if you need further information, or if we tell you about another session we're having and you want to register for it, you'll be able to click directly on those links in the PDF that will go out. So just a little bit of housekeeping to keep things moving there. So we're going to go ahead and get started today. First off, I always want to share, who we are and what our team it consists of. So we have all of our staff listed here. So we've got Amy Tice, who handles all of our operations and communications work, so newsletters, social media, contracting, all of those kinds of things. Nicole Payonk is our policy and advocacy coordinator, so she does a ton of work in the fluoride space and the Medicaid space, as well as anything else that falls into policy. Leah Benishai is our programs and evaluation coordinator, so she's going to be doing a lot of the work like with specific school districts, community health workers, our educational courses, so a variety of different things. Everybody's kind of a jack of all trades here at PCOH. So really, really glad that we have such a great and competent staff to accomplish what we do. Hopefully, for those who are familiar with our work, you've had some time to interact with these folks, but all of our emails are linked directly in the slides. So if there's something you have follow-up questions about, or you want to reach out at a later time, please feel free. That's what we're here for, is to talk with people and learn about what's happening in the state. So it's very, very important that everyone can contact us as needed. I also want to start by asking our board chair, Dr. Joan Glutch, to say a few words as she's here to represent the board today.
Oh, and thank you, Helen. I'm so happy to bring greetings from the PCOH Board of Directors. And certainly, although we look at challenging times ahead, we appreciate all of the work of all of the advocates and stakeholders. That's what PCOH does, is serve as a convening group of advocates interested in really optimum oral health benefits. They need to be available to everyone, accessible, and we're so pleased that you're here to join us. My great thanks to Helen and the staff for all of their hard work that you'll hear about in our presentation today. So welcome, and we look forward to hearing wonderful activities and also to seeing you participate in the variety of programs that we run.
All right. Well, thank you so much.
Thank you.
And of course, wanted to share, we've got, a really great board, and I do want to say a special note of thanks to them because, you know, for those who might work in the nonprofit space, your board of directors is so important. And we're very, very fortunate to have such a wonderful, engaged board. So thank you to them for sure. Okay, so moving on. Again, if this is a brand new, you know, event for you, you may not be as familiar with what our coalition does. So just wanted to take 30 seconds to, you know, share our priorities so that folks are, you know, more aware of what we work on. Of course, workforce is a big priority for us. Dental workforce, which it can include, you know, those who are specifically working in oral health clinical care, but can also mean those who work peripherally in oral health care as well. We also look at policy, so any, you know, whether it's legal policy, regulatory policy, administrative policy, or even just organizational policy. We want to make sure that oral health is included, you know, in different healthcare environments and what's out there. When we talk about improving oral health for Pennsylvania's most vulnerable populations, we're speaking specifically to those that struggle to access the same level of dental care, you know, that maybe others would. So we look at specific populations like those with intellectual and developmental disabilities, veterans, the Medicare population, rural areas, those served by Medicaid. There's quite a few areas where we know we have some deficiencies. So we want to make sure that we're working specifically in those targeted areas to improve that oral health status. And then lastly, we're going to touch on water fluoridation today. That is our fourth priority. Water fluoridation is actually where we started. That's why the coalition was initially started, you know, 10 plus years ago, was to focus on improving water fluoridation status for Pennsylvanians. So that continues to be a measure that we track, monitor, and advocate for pretty much every day. So we'll talk a little bit about that. Of course, always have to talk a little bit about our funders and our supporters. We're so fortunate to have so many different groups that are, you know, believe in our work and that want to support us and help us do it. At a time right now, I'm sure many of you are seeing some changes with different federal funding sources up in the air, state funding sources, you know, being delayed or threatened. So we really do, you know, probably now more than any other time, we really do rely on our annual supporters, both at the corporate level, foundation level, and even individuals to help support our work and get us through what's proving to be a little bit of a tumultuous year. So thank you guys so much. We do try to, you know, we're very fiscally responsible. We use more than 80% of our dollars directly in programming, whether that's completed by PCOH or some of our contractors. And we really want to make sure that we're using everybody's dollars wisely in a way that's most effective. So thank you, thank you. I mentioned this in our priorities a little bit, but because, you know, every year different things sort of rise to the top. And right now our funding and sort of the efforts that are being directed by some of those funders are really pointing into these main focus areas. So, you know, you'll see the alignment, fluoridation, Medicaid, workforce. Those are things that are already identified in our priorities. They're things we've always kind of worked on. But we're really also trying to grow the coalition to make sure that our connections to partners around the state are really highlighted and that we can work together. And then school health is something that more recently has come up. We realize that there's a lot of potential for health to be delivered in schools. And so, you know, whatever we can do to reach that captive audience is going to be super important. So that's sort of where we're going to focus on today. I will say that we do a lot of other stuff too. So if, you know, there's more that you're interested in learning about, our website has a ton of information and a ton of resources on all the different subjects we work in. So definitely check it out if you haven't already. So, of course, we're going to start with a little bit of water fluoridation. Just because I mentioned it as the last priority does not mean it is a last priority for us. We definitely consider water fluoridation to be one of the most important things that we work on. And it's a measure that's really under attack right now. So it sort of forced itself into our daily work. And I want to talk with you guys a little bit about some of those challenges. We've had a lot of great discoveries in the last 50, 60, 70, 80 years, fluoridated toothpaste and preventive dentistry. But those things don't reach a lot of our most underserved individuals. Those are things that, depending on the status of your life, you may have access to, but you may not. And so water is one of the things that we consider to be the easiest way to improve the oral health of all Pennsylvanians. And as of January 25th this year, Community Water Fluoridation celebrated its 80th birthday. So we've been successfully fluoridating, adjusting the fluoride in water for 80 years. So definitely something that we have lots of research that show that it works. So that's something that we're trying to talk a little bit more about. So back in December, I was looking at my notes from our last update, and back in December, I got to this spot and I said, well, the past 2 months have been really the most media active I've ever seen in the space of fluoridated water. And little did I know that the last 6 months from now have been even more so. We really have been inundated with a lot of discussion around fluoride and specifically fluoridation in water. So if you hadn't heard, back in the spring, we had some issues. The CDC Division of Oral Health, which is primarily responsible for tracking fluoridated water and promotion of fluoridated water, was completely eliminated. So all of the staff and, our dental director at the CDC was let go. And so we're sort of in a state of flux right now. We don't know what's going to be happening with the dollars that were designated for some of those initiatives and how that will directly affect, PCOH and the work we do. And then, of course, since January, our Health and Human Services Secretary, Robert F. Kennedy Jr., was officially confirmed in his role. He's very outspoken in his dislike of fluoride. And we've now seen that kind of spiral into 2 different states. Utah and Florida have effectively banned the adjustment of fluoride in water. So that's a little scary that we're starting to see the interest there, particularly in 2 states, not just one. And then we also received word a few weeks back that the FDA is now planning to ban fluoride supplements in the fall. Which can make it extremely difficult for families in non-fluoridated areas to replace their systemic fluoride for kids. So, one of the big arguments that they said for banning water fluoridation is that people can choose to get it in other ways. But if the FDA bans supplements, then we've all of a sudden taken that choice away as well. So something we're watching very closely and trying to figure out some alternatives and things that we can do. I will say in our state, if you've heard anything, we do have 2 legislators, one in the Senate, one in the House, that have introduced memos around banning fluoridation in waters in Pennsylvania, but those have not really gotten any traction or co-sponsors, so we're just kind of monitoring them at this time. So wanted to share that with you all so you're aware. We also track what we call rollbacks in the state. So for a water system that is already adjusting fluoride to the right level, starts to debate that practice, isn't sure what they want to do, have votes, have hearings, have meetings, we call that a rollback. So just since January in Pennsylvania, we've had 4 water systems experience a rollback. So I've got my little marks on the map there. The stars would be for Blairsville and Clearfield, which are 2 areas on the western side of the state that, at different levels discussed halting the process of adjusting fluoride and ultimately decided to go ahead and keep fluoridating. So that's wonderful. We're really excited to see that. We did lose fluoridation in Tyrone Borough, which is out towards Altoona. So that's the red X on the map. And then we have a current rollback being debated right now in Somerset Borough, so right in the middle of Somerset County. And so we're going to be working with some local community advocates there to hopefully reverse their initial decision to stop fluoridating. So that's where we're sitting in our challenges. And I've mentioned some of the work, as addressing those challenges. We do maintain a statewide task force. So if, water fluoridation is important to you, or you want to have a chance to make your voice heard in this space, our task force is available for anyone to join. We primarily share resources with the task force, and then we also ask if an area around you is being threatened. We do ask our task force to be prepared to go and share stories and facts at local meetings. And we will fully equip folks with that information. It's not something that you have to write a 3-page speech on your own, but it's always great to have local advocates in the areas as we start to see these things be debated. We're continuing to work with some national partners. So we do PCOH serves as the Pennsylvania affiliate for the American Fluoridation Society, which is our national group that does promotion for water fluoridation. And so we work with those partners. The American Academy of Pediatric Dentistry did a really big national sign-on letter about a month ago and I believe they ended up with over 250 organizations signing on to say, look, water fluoridation is important, let's keep it. And then we will continue to do, as we have done for about the last 6 years, to work with our individual water systems. So in Pennsylvania, we've got about 1,800 water systems around the state, and each water system decides on its own if it wants to adjust fluoride. So we want to be a resource for them. We've had some reach out if they're having questions and concerns from consumers, then let's talk and let's go over the data and look at the research. And if you have a concern about something, we want to be able to address that. And we're also continuing to collect information on, if systems are optimally fluoridating, right? So just because a system says we want to adjust fluoride in the water, we want to make sure that they're doing it at the exact level that is the best for teeth. And so we're starting to do some more data sharing and collection along with a lot of other states at the national level on those numbers. So if you want to help, for many years, we kind of just kept quiet about fluoride because we didn't want to stir the pot. But I'm pretty sure we can all agree that the pot has been stirred. And so, for us right now, we want all hands on deck, everyone talking about fluoride, everyone sharing how important it is, because there have been some recent reports. If you guys have seen, there's an article that came out about a week ago that was showing, how many tens of millions of cavities Americans will get if water fluoridation stops. And so, this is very, very important information to share. We have dental providers even that are starting to kind of doubt and read the headlines. And so we want to make sure that everyone feels equipped to talk about it in a way that's informed. And so you can join our task force. There's a link there. So you'll be able to click on that after if you want to be a part of the task force. We're also going to hold 2 forums, just open forums over the next few weeks, where people can just come to ask questions, ask about the status of certain things in Pennsylvania around fluoride. If you're looking for resources or you want to share a story, we just wanted to make a space where people could feel comfortable coming and learning and sharing information. So we will be holding those, and the links will be live in that document you'll get, so you can register for those 2 events if you're interested in that. So with that, I'm going to move on to our second area of work right now, which is in the Medicaid advocacy space. So our lovely little pictures there are actually Nicole and I with some of our partners down in Washington, D.C., doing some federal advocacy this spring. And what I've been telling everyone is that every time we've ever gone to D.C. in the past, Medicaid has always been sort of a hushed up topic that we don't talk too much about. And this year, everybody's talking about Medicaid. So much like fluoride, we're just blowing it up. We're bringing it up to the surface, and we're going to talk about it. So that's something that's pretty neat. And we'll walk through some of the challenges that we've had in this space. But it's definitely something that's being talked about a lot more. So when we talk about Medicaid and sort of where our concerns and challenges lie, we talk mostly, I think the number one thing that really comes up is in Pennsylvania, it's network adequacy. So every insurance company out there is responsible for having an adequate network of providers. So if you buy an insurance or you have an insurance, you have to actually be able to have a provider to go see that accepts that insurance. Otherwise, that wouldn't be very helpful. And so our state really has struggled in the Medicaid space for network adequacy because really less than 10% of our dentists are regularly participating in seeing Medicaid patients. So that's a really big deal for us, and we're trying to figure out how we can increase the number of Medicaid providers that are out there and available for the Medicaid population. If you didn't know this, we have about 3 million people that are served by Medicaid in Pennsylvania. So, it really is probably the largest health coverage for any other, population in the state. And so we really want to make sure that those folks have access to dental providers. There was a recent increase that went into effect in January for the Medicaid fee schedule. So some of you who may be providing care for Medicaid patients have probably seen that. So there were specific codes that were increased by 27%, which was wonderful. And the only issues that we had with that is that there were a higher percentage of codes that were more skewed towards children's care, and our adults continue to struggle to find providers. So, that's something we're keeping an eye on. We want to make sure we're continuing to work towards also helping adults in that space as well. The little map that we have shared here, and then there's a link in the box, was actually a report and sort of dashboard put together by the ADA's Health Policy Institute. What's really great about it is that it shows you the reimbursement value in Medicaid as compared to not just the dentist charges, what they would charge their normal fees, but it also shows a comparison to what a commercial dental insurance, like a Delta Dental, would cover, in comparison. So it's a really nice way to sort of see how our Medicaid program is doing in parity. And what we have found, and they do break it down for adults and children, but you can see that the states, and even though New York is the same color as us, they're still 7% higher. We are actually sort of the lowest payer in the regions, around Pennsylvania. And so if we're only paying 30 cents on the dollar for some of the services that are out there, it's very, very difficult to have Medicaid providers come on board. So these are some of the challenges that we're dealing with. And then we're also, of course, watching the federal budget very carefully because, right now, children's dental coverage is covered under Medicaid, is guaranteed under Medicaid. Adult coverage is not. So even though we have, somewhat of a limited benefit in Pennsylvania, really we don't have to have any benefit. And so that's something that as federal dollars could possibly be cut in the Medicaid space, we're watching very closely. And I keep telling everyone, I'm not going to try to guess what's going to happen in the next few months in this space because every day it's a different story. But we're watching, we're most concerned about protecting adult dental benefits under Medicaid, also protecting the expansion population. So, the group that is in that 125% of federal poverty level, sometimes what we call the working poor, those folks definitely are at risk if federal funding is cut. And in Pennsylvania, that's about 730,000 people. So, something we're keeping an eye on. We don't want anyone to lose dental benefits. It's hard enough to use them right now, but we need them in place. So those are sort of our challenges. To sort of counteract that, our adult dental benefits were transitioned from a fully comprehensive benefit back in 2011 to somewhat of a more limited benefit. We've been working since then to restore the adult dental benefit and to have comprehensive coverage in the state. So last session, and when we talk about legislative sessions, our state runs a 2-year session. So 2023, 2024 was one 2-year session. And we had 2 bills, one in the House, one in the Senate, introduced to restore the adult dental benefit last session. Our House Bill 1417 was able to pass through the House and get over to the Senate, but it died in the Senate, and the legislative session expired, and we did not get that bill passed. Luckily, we've got some great advocates in Pennsylvania, and as soon as the next new session started in January, we were able to have the adult dental benefit reintroduced in the House. So that's House Bill 583, which is linked there. And just last week, it made its way through the House committee that it was assigned to. So we are now waiting for it to go to the full House for a vote. So that's pretty exciting. It's nice to see a little bit of legislative progress. It doesn't take away the fact that we still need things to be funded. We still need the dollars to come through. But if the law and the rules can reflect the importance of that comprehensive benefit, that's a big win. So we're watching that very closely, doing as much work as we can. And if you have any more questions or anything about that, please let us know. We're working with the ADA and the Department of Human Services and the Department of Health Oral Health Program on a pilot project to increase the number of Medicaid providers in the state. So we're one of a handful of states doing that. So that's a project that will be running through the end of this calendar year. So we're hoping to see some increases in the patients and the members that our dental Medicaid providers are seeing. I did want to mention we're doing some work in the CHIP space. So CHIP has been sort of a little bit of an outlier in some of our work in the past. So that's the Children's Health Insurance Program, if you're not familiar. And we were able to confirm with the Department of Human Services that public health dental hygiene practitioners are able to enroll as CHIP providers and be credentialed with the managed care organizations or the insurance plans that are served by CHIP. So that's something that is sort of a new thing that we're pushing on, and we'd love to see more and more providers getting enrolled in that space. So the last thing I wanted to mention in the Medicaid area is that we are also hoping to put together what I'm calling a pain points document, but all of the different administrative burdens and little things that are sort of affecting dental providers and their ability to serve Medicaid patients. Because it would be great if we could make some small changes that would improve the process for our providers and keep them enrolled and keep them seeing Medicaid patients. So those are a few of the Medicaid pieces we're doing. We do want, all hands on deck, and for those who are already getting our newsletters, we will definitely keep you posted if House Bill 583 gets through the House. We're not actually, once it's set for a vote in the House, we will probably be reaching out for everyone to talk to their representatives. But we think we'll need more of a push in the Senate. So that will definitely be a time where we need a lot of help in getting our senators to support the bill. So stay tuned for that. If you are a dental provider and you're not currently participating with Medicaid, we always like to tell everyone, you don't have to take 60% Medicaid in your office. You can take 3% Medicaid in your office. And even if you don't take other insurances, you can still take Medicaid, which is a great way to help your community every day of the year, right? So you have 365 days that you can help your community out and be a dental provider for those who are less fortunate. So something to think about. And then if you have any challenges, whether credentialing is taking too long or some of the computer glitches or anything like that, please do share those challenges with us as we're trying to compile them over the next year. So that's really important. So our next subject I wanted to touch on is workforce. So we've got a lot of things happening in the workforce space. And when we look at the challenges there, we're really, overall, I have to say, if I had to say one thing that was the biggest issue, it is actually just sheer numbers. We don't have enough dentists. We don't have enough hygienists. We don't have enough front desk staff. We don't have enough EFTAs. We don't have enough dental assistants. We just don't have enough. And very few regions of our state right now have an overabundance of any type of provider. So this is a space that, how do you make more dentists by, next year? That's pretty hard to do. Making a dentist is like a 10-year plan. So, when we look at some of the way these numbers are shaking out, we're looking at, do we need more programs in some of these spaces? So the map I have on the slide here, our little silver stars are our dental hygiene programs, our gold stars are our dental schools. And as you can see, we've got some pretty wide areas of the state that have no stars at all. And so especially in the dental hygiene space, that's an area where a lot of folks don't travel far for those programs. So if you've got a 10-county radius with no dental hygiene program, chances are those folks are not going to go to one of those programs in the southern tier, which means we're just not getting people working in that space. And so there have been a lot of really cool things coming out over the last year, and I won't speak for our other partner organizations, but there are definitely new ideas coming down, and I'm sure some of you have seen the University of Pittsburgh actually announced this week or last week that they're going to be doing sort of a hybrid dental hygiene program up at Titusville, which is in the northwest area of PA, as well as a rural residency program. So these are the things that we're tracking and we're watching and we know can be effective. So just getting our sheer numbers up is going to be a big help, and making sure that we're encouraging those entering into the career space to think about dental. So, a lot of high school and undergrad students may not be thinking dental. And I think if we can get more applicants to all of these programs from Pennsylvania, we're going to see the end result being that more graduate from these programs and stay in Pennsylvania. So that's something we're following very closely. We're also looking at our, kind of things that are happening in the dental assisting space. Also, which providers are willing and able to see specific populations. So we know from the 2023 licensure survey that only about 40% of dentists are seeing patients with severe disabilities. So again, that's just a number that isn't going to work. We've just got too many people that need care. So we're focusing on some of those specifics as well. And then the last licensure survey, also showed that, anywhere from 25 to 35% of our dentists and hygienists are planning to retire in the next 5 years, which we're only replacing them at about 10% of that margin. So that's going to be a really big problem. And we expect our provider shortages to actually get worse for the next few years. So now is the time that we're trying to act on that. So we're working very specifically in the dental assisting space. We've been going around talking to high school students and trying to get them interested. We had heard, from a number of folks that chairside trained dental assistants were not doing very well with the radiology exam that's required for them to take x-rays. So we just launched our third iteration of our DART program, which is Dental Assistant Radiology Training, which has been really popular. So having a dental assisting instructor be able to teach the students, 20 hours of just radiology training so that they can then pass their radiology exam and become more efficient in their roles as dental assistants. So that's something that we're really proud of that we've launched this year. We were successful in adding dentists and hygienists to a current bill that's sitting in the legislature right now, which would focus on loan repayment dollars for those who want to practice in rural areas or federally qualified health centers. So again, the initial bill did not include dentists and hygienists, and we were able to get them to do an amendment for that. So that's very exciting. That could open up some loan repayment dollars. We've also been holding a series of Hot Topics webinars, so hopefully you guys have been able to join us for some of those. We do have them on our YouTube channel if you've missed one, but focusing on things like loan repayment, just straight licensure numbers, changes over time, what does the last decade look like, in our workforce. And then our Speakers Bureau is really a volunteer database of providers out there who are willing to go out and talk to kids, students, middle school, high school, even undergrad level, to really talk about dental careers. We've got a variety of materials that we share And so we're just looking for volunteers that might be willing to go to their local career fair and talk about dentistry as a career. So that is a really great new opportunity. And we have a link on the next slide that will actually allow you to register for that if you haven't already and you're interested. And then we continue to work through some of our HRSA-focused projects that are workforce. So we're talking with community health workers, trying to increase the number of those who are offering oral health education and referrals. We're working with the dental schools and dental hygiene programs to talk with them about public health career options and populations that, may need more assistance. Right now, we're focusing on older adults with that program. And then also putting together some infrastructure, right? So looking at a pipeline plan for what are we going to do in Pennsylvania to get these numbers moving. PCOH was thankfully awarded 2 grants this year that are focused entirely on increasing the dental assisting population. And so that's really, really great. We're looking at the vocational and technical career schools because only about 25% of our programs in the state offer dental assisting. So that's a big miss, right? So for students who are looking to enter into a technical career, if dental assisting isn't offered by your program, you're not going to go into dental assisting. So we'd love to see all 80 of the programs across the state offering dental assisting as an option. So that's a nice long-term plan. So how you can help, I mentioned the Speakers Bureau. So yes, please sign up for that if it's something you're interested in doing, going and talking to students. I find it very interesting. If you ask a classroom of middle schoolers, what kind of dentist they would like to be, every single one will say orthodontist because they all worship their orthodontist. But it's really interesting to be able to share some of that information with them and give them some feedback. We mentioned here minimally invasive care, something that I have to point out. We've done some trainings on minimally invasive care, so meaning less drilling, less filling, more medical treatment of cavities, using all of the tools that are in our toolbox to be more effective in reducing cavities. This is going to be really, really important as the numbers continue to decline. Because if it takes a dental provider 45 minutes to treat one cavity, that's a pretty long appointment. And using some of the new minimally invasive care techniques, if we can knock that down to a dental hygienist being able to treat that same cavity in 3 minutes and saving that dentist time and chair time for something else, or being able to see, 20 patients in an hour instead of 4 in an office, those are ways that we're going to be able to really stretch our dental workforce. And unfortunately, I think we're going to have to. We're really going to have to stretch it over the next few years to keep everybody, moving and healthy. So that brings me to school health. And I mentioned that we've sort of seen a turn to the focus in this space. A lot of it is, we kind of all, when we think about kids and kids' oral health, we think about that being a space for opportunity. Because if we can decrease the amount of disease in kids, obviously we're going to see less disease in adults. And so, it's hard sometimes to get kids in chairs and to get kids to brick and mortar dental offices. So schools are a great opportunity to go to where there's a lot of kids. It's a captive setting. They can't go anywhere. They're there. And you can see a lot of kids in a short amount of time. So in a situation where we know there are some disparities in places where we're lacking, school health seems to be a really great idea for starting to address that. So when we talk about challenges, if you're not familiar, just as a basic background, Pennsylvania was able to complete what's called a basic screening survey back in 2022, which measured the amount of dental decay that kids have in the state. And so we have a full report there that the PA Department of Health Oral Health Program published. It's linked on the slide, so you can check it out. But just to give you a quick idea, we know that 60% of third graders in the state have had cavities. So that's a pretty significant amount. We also know that about 25% of our third graders have untreated cavities. So meaning an open cavity that has not been treated, that is an active infection. That's 1 in 4, which is pretty crazy. So we know there's a need there, and that's why I wanted to share that, just to demonstrate that we know there's a need. And so one of the things that we've been looking at is, currently in our state, school districts are not really able to be quote unquote Medicaid providers, right? They're not able to bill Medicaid directly for services that are offered to all students. There are some ways that they can do it with, if a student has an individualized education plan that requires a specific thing, they can bill Medicaid for it. But in terms of treating a whole population out of school, they're not able to do that. So we're monitoring. The state has a grant right now where they're looking at that space in the behavioral health setting, where schools might be able to bill Medicaid for those services. So we'd kind of like to piggyback on that and see if we can get dental involved. Because if schools are able to bill Medicaid, they could then employ, folks like certified school dental hygienists as an employee of the school district who would be able to offer services to the entire population of the school, which would be great. We've also seen, the fluoride programs, and really we want to be offering fluoride varnishes at this point in the schools. We've seen some decline in that space. We've been working with school nurses, trying to see if we can get them on board. We're seeing our certified school dental hygienists and the number of dental hygiene services programs in the state kind of sinking slowly. And so we're having fewer and fewer of those. And then, I mentioned that basic screening survey. So we have the data from 2022, but we need to do another one. It's recommended to do one every 5 years to see if we're making progress. Are we losing ground? Are we improving? We don't know if we don't do a second survey. So that's something that right now we don't have any current funding for. And so we're specifically targeting grants and programs that would allow us to do that next round of basic screening survey and see where we're at, which I think is pretty important. So, when we're talking about that, I mentioned our school nurse collaboration. We're working with the state association. We've done some training. I think we've done 3 training sessions with school nurse groups to try and talk a little bit more about oral health care and why it's important and how to help them make good referrals in their communities. So that's a space that has been a great collaboration for us. Medicaid advocacy, I mentioned working with that grant that the state currently has and trying to hopefully piggyback for dental care as well. And then our partners at the Pennsylvania chapter of the American Academy of Pediatrics actually just released a pretty amazing varnish promotion toolkit, along with some other things, varnish promotion, but really all school oral health related. So I have that linked in the slide there. I hope that's helpful for everyone, especially if you know of any school employees and they're looking for resources. That's a great thing to have. And then the Department of Health Oral Health Program has been working, finishing up a sugar-sweetened beverage campaign. So trying to really target adolescents in areas where there are dental health professional shortages and talk with them a little bit more, working with community organizations to kind of go out, talk about sugar-sweetened beverages, talk about tap water as best. We have a number of different materials available for that now, including an acid demo kit, how much sugar is in your beverage. Some of you have probably seen the Rethink Your Drink boards and, think along those lines. That it's just really great for kids to be able to see what they're getting and maybe to make some better choices moving forward in what they're drinking. Because at the end of the day, we don't want to see kids drinking sugar all day, and we're still seeing that in a lot of communities. So just a couple of the things we're working on, and we will be also putting out, a formal report. So we have had a consultant working with us over the last almost year now to complete a report on school health and dental services in schools and potential for some policy recommendations and things that we can change. So that report will be published by the end of the month. So stay tuned. I know that's just a few weeks away, but what we would really love then is, for all of you as stakeholders in PCOH to be able to take that report out and use it, right? So If a recommendation is that a school should do X, Y, and Z, well, then let's get schools to do X, Y, and Z. And so stay tuned. We'll be sending that report around as soon as it's finalized. We encourage you to check in with your local schools. If you have connections with the school district, please, please, please do that. And then we also, we assist the Department of Health with their school sealant programs around the state. So if you know of school districts in your area that could benefit from a school sealant program, we can also help make some of those connections if we have one in that area. So just a couple things that, if you're looking in the school health space of what you want to do, that's a good thing. So when we look at the last section here, we really just wanted to touch on some of the connections we're making around the state and some of our outreach that we've been doing. So we call it conference season around here, but spring conference season was especially fun this year. And so as you can see, PCOH staff were able to exhibit at or attend 19 different events so far already, and reach almost 4,400 people. So that's amazing. That's wonderful. That's us talking to people, sharing our resources, learning from what they're going through, and trying to tweak and adjust our programs to serve the public out there. We were able to do presentations at 16 different events in 3 different states so far this year, 16 hours of presentations to over 500 people. So that's been pretty amazing, something that we all enjoy doing. We were able to do a lot of information shared with every member of our General Assembly, so all of our legislators in the state. And then that picture I showed you guys earlier, Nicole and I were able to go down to DC last month and do some federal advocacy as well. So it's always great to share the word about oral health, and so we've had some great opportunities to do that. I wanted to mention we are going to be launching some outreach to obstetricians here in the next few months, so really focusing on that maternal pregnant population. So stay tuned in our December webinar. We'll give you some updates on that. And then when we talk about engagement, so, everyone who follows our newsletter, attends a meeting, you're a PCOH stakeholder. You're somebody who cares about oral health, who's connected with us. And so we've been making some more concentrated efforts on tracking those things. So we still have a few counties in the state that don't have a PCOH stakeholder in them. Now, probably 1 or 2 of you on this call are saying, wait, I live in that gray county there, but I'm a stakeholder. Well, if we don't know your address, we can't mark you down as a stakeholder in that county. So there are, we have a really great database available through our website where you can update your address, your contact info. I believe it's in every single one of our signatures. So if you send us an email, you're going to see it. But we want to make sure we're capturing, and we'd love to have full 67 county participation across the state for folks that are working with us. So we've got about 1,100 individuals and organizations right now that are in our database. We have actually distributed more than 6,000 copies of our materials so far this year, which is crazy. 1,600 Facebook followers. 13,000 different people have gone to our website just this year, which is wonderful. And over 2,000 resources have been downloaded directly from our website. So we know that we're doing a great job with our reach. Thanks to Amy for tracking all of this so well, and really focusing on, where we can improve. But if you know folks that aren't connected with us, please let them know. We would love to talk more, with different organizations, and every single day we get new friends. We make new friends every day, and that's pretty exciting. So if you're not following us on social media, please do. We do send that weekly newsletter that I know many of you are checking out, but sometimes there's information we don't put in a newsletter, but we do share on social media. So if you have accounts on those platforms, definitely make sure you're connected with us, because you may get some additional information. And then my last couple slides here. So that's your cue if you have any questions to start typing them into Q&A now. But our last few slides, we wanted to mention every 2 years we have our statewide summit. And so this year is a year to have the summit. So many of you have already committed to, helping on our planning team, supporting the summit with donations and sponsorships. You know, we are planning to launch registration for that event. It usually comes pretty darn close to selling out. So if you mark your calendars now and you want to come, it's a 2-day event, November 12th and 13th in Harrisburg. And the registration will be out in the late summer. So watch for that. We still have a handful of sponsorship opportunities available. So if your organization hasn't been able to finalize that yet, definitely let us know. I think we have 2 or 3 different sponsorships left from our sponsorship package. So, and then we'll also be putting out our award nominations pretty soon. So we do like to recognize folks with awards at that event. So if you know someone in your community or even yourself that's doing a lot in the dental, public health, oral health space, please, please, please consider submitting a nomination. We're hoping in the next couple weeks to have those out. So stay tuned. We'll have that information on our website as well. And then I mentioned this, but we wanted to do a little bit of a special focus on it. We are having those 2 upcoming fluoride forums. So if you want to learn a little bit more about the state of fluoride in our state, or you have questions or you have comments or you want to offer suggestions on ways that we can move forward in the fluoride advocacy space, please do consider attending. I know we've got a few dozen folks already signed up for these, but we're going to have an evening event next week and then an afternoon event the following week. So hopefully that fits. They're not going to be recorded because, obviously it's an informal chat. So want to make sure that if you want to join and learn, please do make sure you register. So we'll get those links out. So with that, I'm going to take a breath, take a sip, and see if we have any questions, if anybody is still typing into the Q&A. I will say that this might be the first time ever that we haven't gotten a single question, which would be very odd. But I am going to say that that might be because so many of you are connected to us on practically a daily basis that, you can ask us anything at any time. But okay, thank you. And yep, so no questions. I'm not seeing any coming through. Just double checking. Give it one more minute to make sure. Okay. So please feel free, even if you didn't have a question, but you have one come up afterwards, you can always let us know. We're more than happy to answer those questions at any time. And we will make sure that we get the slides out and the recording for the presentation right away. So if you're looking to register for Monday night's fluoride session, you'll have the information, I promise. And hopefully we'll see some of you on Monday evening for our fluoride session. All right, guys. Thanks so much. We'll see you all soon.